Hi guys, it's Dr. Zach. I'm here with Dr. Bryn today. We're chiropractors at Wurth Chiropractic in Erie, Colorado. We're going to be opening up our office here sometime, hopefully in May, maybe
soon.
June, kind of whenever this pandemic gets past us. We're really excited though. I got a chance to go to the building today and are just really excited for you guys. So we're here today with Erica Faulhaber from New Directions, Colorado in Erie. She's a licensed professional counselor, and we're going to give her the chance to talk to you guys a little bit about herself. So go ahead, Erica.
Hey, thanks so much for having me on today. I think it is really important, especially during a pandemic, to be talking about mental health and emotional health. And so I'm glad that you guys had me on as your guest today. I'm with you guys, new space, wanting to be utilizing it, and right now is just not the time. So I am a community member of Erie. I am a Colorado native, and so most people don't know that about me, but there's very few of us left. So me and my husband are both Colorado natives, and so we ventured up north just to get a little change of scenery about a couple of years ago. And then that's kind of when I shifted one of my practice locations to up here. And I've got 2 dogs. They're keeping us busy during the pandemic. In between sessions, I'm trying to get them walks, and they think we're home for them right now.
Yes.
Right?
Absolutely.
Important
Very
things.
much so.
Yes. And so we love being outdoors. We like connecting with other people in our community. So this is a really exciting time for me too, to connect with other people to collaborate with in all that I'm doing.
Yeah, cool. That's awesome. Well, and many people might not know, I'm from Iowa originally, and Bryn is from Ohio. So as 2 transplants, one thing I will say is that we've been really impressed with how welcoming people have been. You know, we're Midwestern people, so we get that Midwestern hospitality. But I don't know what we were expecting when we came out here, but we've just been pleasantly surprised. Everyone's treated us really well and everything like that.
Awesome.
So thank you for that.
Absolutely.
Yeah. So talk to us a little bit about what you do specifically as a therapist, maybe some of your treatment options, or just, kind of what you do day in and day out.
Yeah, so I typically see individuals in my practice. I do groups time to time. Those groups could be support groups, they could be psychoeducational groups. I typically do groups around body image, self-esteem, sexual abuse survivors. That's another one. And then when it comes to individual therapy services, I typically see ages 14 and up. And I see all females in my practice. So women, teens, and tweens, that's what I like to say. And I really focus on eating disorders and disordered eating. There is a differentiation between the two. And then I also work with trauma. And to the best of my knowledge, I am the only EMDR certified provider in Erie. And so that's pretty big. There's a couple folks that I know of that are trained, basic training, but I am actually certified in it. And so that's one of my go-to methods. EMDR stands for eye movement desensitization and reprocessing. It is a mouthful.
Okay, yeah.
You got it though.
Yes, and so that's one of my go-to trauma response interventions. And it really taps into not only, the pieces that are happening with mind, but also with body. And so it's more of a somatic based approach, because as we know, trauma sometimes gets caught in the body. And so, that's kind of a little snapshot about, what I do. I have had folks come in that want to be working, with a younger population with their parents. I do not offer family-based therapy. However, I love working on treatment teams where there's a family-based therapist involved too. So part of my framework is also working with full team approaches. And what that means is with eating disorders, especially, I like having many people on board. And usually that's 4 things. That's a therapist, which is me. That's a registered dietitian. That's a physician or a pediatrician. And that's a psychiatrist if needed. So again, full team approach, because there's a lot of different pieces. of a puzzle to a human.
Yeah.
And so that's
Absolutely.
where it's also helpful to know you guys in this realm too of, what is happening somatically in order to get people more connected with their bodies during eating disorder treatment specifically.
For sure. That's awesome.
I know one reason we really love talking to other healthcare providers is because we get to learn a little bit about what they do, and some of those terms are really new to me, and it's really cool to hear about some of those treatment options for some of those different cases. So, like you were kind of talking about how this kind of plays a role with us as well, mental health and all of that in chiropractic, and where does it fit? A lot of times we kind of go off this biopsychosocial model. I know we talked a little about it with you as well, and how mental health is such an important part of pain, somatically, all those sorts of things. Oftentimes we can see mental stressors kind of exhibit in the form of physical pain. And that's kind of where we can play a role too. And vice versa, we can often see physical pain have a role in mental health, and that's where you come in. So it's really cool. And like you mentioned, collaborative care, how important that is for the patient. We are really big. We're huge on collaborative care. What's best for the patient and all that. So it's great to hear that, that you're doing collaborative care and things like that too. So
yeah, and the continuity too with it, right? We want a seamless process for our clients or patients, because the last thing we want is to be adding more stress during perhaps very stressful times, right?
Absolutely.
And so if we're able to kind of orchestrate, our treatment plans together, that can be very beneficial for clients. So that way it's not another thing that they have to worry about of like, oh great, now I have to go find a chiropractor or fill in the blank, right?
Yeah.
I think the other thing too is, focusing in on a person holistically, meaning in my practice, even down to my logo, it's a heart and it has 3 lines coming out of it. I don't know if you guys noticed that.
Yeah.
But the heart, I feel, is at the center of my practice, meaning I want people to embrace like that core change inside. And then from there, I also want to talk about body, right? Mind and spirit. And so whether that's, coming from a place of something that they've done in their lives outside of therapy practices, right? All those different parts of themselves. Or if it's the first time that they're really learning on how can I really recognize these different parts of myself to better care for recovery from that standpoint too.
Yeah, that's really cool. I mean, going kind of back to the collaborative care too, for us, a lot of times even healthcare professionals don't know exactly what chiropractors do. So we need to do our part in not only educating our patients, but other healthcare providers, so they know what cases to kind of send our way and
what we can help with too.
Yeah, absolutely. So that's plays a huge role in patient care. That's really awesome.
Yeah. I think being connected with you guys too, with the collaboration with even the chronic pain or folks that are experiencing suppressed immune systems right now, it can be very helpful to have you guys helping with that somatic piece again.
Yeah.
And chronic pain's huge. I mean, that's just the biggest thing that we see a lot too. And a lot of time chronic pain, the biggest thing is of mental capability with it too. And it's hard to kind of bring that full circle. So if you can help with that end and we can help with the physical end, it'll make all the difference.
And it's been, and even kind of some of the latest research too is following this trend of this, the biopsychosocial model, really incorporating that mental health aspect into patient care is really important. So again, So I think you've kind of mentioned it throughout a little bit, but can you tell us kind of some of your options right now that, like, if a patient wanted to see you today, how they would go about doing that or things like that?
Yeah, that's a great question. So right now, like most folks, I'm offering what's called telotherapy. Okay. Telotherapy goes by many names: online counseling, distance counseling, virtual counseling. And what that is it is done via video. And much like this, or like a FaceTime, but it's actually through my HIPAA compliant system called Simple Practice. And so clients can connect with me to get set up with that. And then what happens is they are sent an individual link for their sessions, much like Zoom again, or something to that effect. And then they just join that way. So in this moment, I'm seeing people virtually. Folks that are wanting to do more group-based things, I'm still trying to wrap my arms around what that could look like virtually. So more to come on that, but in the moment I am still doing individual sessions just at a distance. So I hope to resume in person. For me, I feel like that's the best way I can connect with my clients. There's just so much, it's just different. So much you can do just sitting in a room with somebody. And so, well, I'm glad we have technology. I do envision going to almost a combination of the two. And so if folks are like, hey, I really can't get there, at least this is an option. And then hopefully we can also do individual as well. So folks can reach out with my phone number, with my email, through my website. There's a contact form in there. I do also offer a free 30-minute consultation over the phone just to make sure that we're a good fit. I know that not every therapist and client is a good match. And so if it's not me, I would love to help somebody find the right match. And if it is me, great. I can't wait to work with that person.
Awesome.
You're preaching to the choir. It's great to hear all these things and knowing someone like this is in the area. It really is. It's refreshing and we do appreciate it. And telehealth, and obviously many words for it, is something that we plan on doing as well. It's like you said, it's not quite as great as the in-person adjustment.
We'd much rather be able to, actually use our hands and adjust you. But
but like you said, giving patients other options is just incredibly crucial for times like these when they're not able to come in, whether the other things come up. So having those sort of options, we think is really great.
And we can do the same thing too with the online consultation, figuring out the right kind of fit too. And if it's not us, we can get you to a different chiropractor that's all good with us. So
and we will definitely include all of your business's info at the end of our stuff. So please check your stuff out at the bottom of our post. So to kind of end this a little lightly, I guess, even though it's been fairly lighthearted most of the time, we want to, lighthearted question at the end. So we just want to ask, what's been your favorite part about quarantine so far?
What have you been grateful for, I guess, is another thing that you could do too.
Oh, yes. Oh, so many things.
Kind of broad.
We'll do personal and business related, right? So we'll do personal. I mean, I'm so grateful for health and for all the resources that we have. I think that we are in a very fortunate and blessed position where both my husband and I can work virtually, and we are still working. And for our health, I mean, that's huge right now. I think just having the ability to do what we do, go out on walks when we can and still enjoy that. I know that there's a lot of folks that are struggling with that as well, health-wise. So I think those have been really good, being able to spend more time and seeing each other. That's very different than life pre-pandemic. We were, kind of like just doing our busy schedules, and now we've been able to eat meals together in between work and connect that way. And then I think, I'm really grateful professionally to be able to be connecting with more people. I think I have more flexibility right now with my schedule. And so being able to connect with you two today, I've been on so many calls just with other mental health colleagues that it's just been really a blessing to be connected with them, because I think I heard this great quote this past week that we're all in the same storm, but we're not in the same boat. And that really resonated. I was like, we are all doing this pandemic together, but literally our circumstances could be very different. And so I'm just very grateful for the flexibility to be connecting with different people and find out how they're going through it and how best I can support them. So, that's kind of where I'm at.
I love that quote.
So
that's really a really good quote, and it's really great to keep perspective with a quote like that. So I guess we can kind of answer too, personally. So I've enjoyed, what have I enjoyed? I've enjoyed the time at home. We've, spending time with our office manager and / dog. Ruby has been wonderful.
She's been really happy. So
she is precious.
We've done the very typical quarantine things. We watched Tiger King, those sort of things. So
I hit my book quota for the year. So I hit that goal this year. I
nice.
Years, so now I'm at 18. I decided to add another 5. Why not?
Brent.
I
overachiever.
I don't know where this reading thing came from, but it popped on in January and I've just been going since. So whatever.
Right.
But hey, I'll take it.
Yeah, but from a business perspective too, we've had the opportunity to really kind of hone in on who we are as chiropractors, the patients that we want to treat. Yeah, having the luxury of not opening yet has really kind of given us that chance to hone in on some of those things. So we're very grateful for that as well.
Perfecting a lot of little things that we still need to.
Yeah, and kind of reading relevant content, and like we've gotten in on a couple Zooms with colleagues as well, going over patient care. So that's great.
It's really cool. Everyone's really kind of come together and is working a little bit harder together, and it's just been kind of neat to see. I hope we take some of these good things that we've gotten from quarantine and take it into the future too. So
yeah, definitely learning. I think even different business models, like you guys pointed out, I didn't even think about that. That is huge right now, because how different could we be after this? Of wow, I have more treatment options. I have the availability to see my clients when maybe they need me the most. So I'm with you guys on that.
Yeah.
It's good to be adaptable.
It is.
You gotta do what you gotta do.
Yes. That psychological flexibility right now, that's happening a lot in my sessions.
We're getting stronger. Yes, it's a good thing.
Are.
Well, Erica, thank you so much for joining us today. We're hoping to get this posted obviously tomorrow for Wurth Wednesday, and we'll have all of the New Directions info in there, and we look forward to working with you.
Great. Thank you guys. I look forward to working with you guys too.
You bet. You have a good rest of your day.
You too.